helping to make your life easier. Local every day.
Today we are addressing a topic that happens in pregnancy. It's Group B strep. Dr. Katie Fossen is here with Gynecology and Fertility PC. Nice to have you here today, Doctor.
Hi, Taryn. Good to see you.
So let's start with what it is. What is GBS?
So GBS is Group B strep, which, like you mentioned, it's a bacteria that about 30 to 40% of pregnant women will carry either in the bladder, the vagina, or the rectum. And it's important because it's a bacteria that babies don't have immunity to. So usually moms aren't going to have any symptoms. If it's a UTI in pregnancy, we treat it, but very unlikely for mom to have any symptoms, but can be a big problem for babies.
How would you know if you have it?
So basically we screen at 2 different times during pregnancy. So we're going to do a urine culture at the beginning. If it grows GBS, but not to a level of a UTI, we just assume it's there. We say, okay, we're going to treat you at the end. But the other thing that we do routinely is do a culture of pregnant women's vagina and rectum at about 36 weeks. And if it grows it, then we treat.
Okay, so you do this for every pregnant woman.
We do that for every pregnant woman.
All right.
And then, yeah.
And then you go from there. So how often does it happen?
So about, like we say, 30 to 40% of women will carry it, just as normal flora. And then really important that we, treat for little ones.
All right. So what are the possible impacts for the baby if it's not treated?
Right. So during the pregnancy part, pregnancy impacts, we treat mom with IV antibiotics during labor to protect baby. And that can most usefully kind of protect baby against what's called early onset Group B strep. And that's going to be maybe like a lung infection, blood infection, or even a meningitis, like a brain infection, in the first 7 days of life. So treatment that we can do during pregnancy protects against that. There can be late onset GBS, though, that happens due to usually community exposure. That we can't prevent as much with the IV antibiotics, but really important to do the early treatment during labor because that can be the most dangerous.
So you don't treat it before labor?
We don't. We treat it during the labor process when baby's most likely to get exposed coming through the vagina.
And once you treat it, then it's over.
It's over.
You're great.
There you go.
Okay, wow, did not know about all of this.
Yeah.
So doctor, if people want to know more about what you guys do, where you're located, how can they find you?
Yeah, absolutely. Our website is gfertpc.com. We are an all-women practice. We love new patients. We love to talk to women, and we'd love to have them.
Yeah, I'm sure a lot of patients like talking to women. They feel like you understand.
There you go.
Topics like this. Okay.
Sure.
Great. Well, thank you so much for coming in today,
Thanks so
Doctor.
much.
Yeah. And for more information on Gynecology and Fertility PC, just go to 1011now.com.